Good afternoon, everyone, and thank you for joining us for the news briefing on this Wednesday. The Vistra energy fire in Moss Landing remains a top concern for our area residents. So we are very pleased to have our County of Monterey environmental health staff here. We want to make sure that we are able to update the community on the work that they are doing. So we have Rick Encarnacion, who's the director of our Environmental Health Bureau, to share with us the status of things and any new information there might be. Hi, Rick. Thanks for joining us.
Hi. Thank you, Maya. Good afternoon, everybody. Rick Encarnacion, Director of Environmental Health for the County of Monterey, Bureau Chief. The County of Monterey and its partners, Cal EPA, DTSC, and Cal Recycle, among others, conducted soil and water testing last Friday. Our partners at the Office of Environmental Health Hazard Assessment are helping us interpret the screening findings. At this time, we're still waiting for the interpretation that will help us as a county direct next steps. The Environmental Health Bureau is responsible for ensuring proper cleanup by the responsible party. So it's very important for us to tell the people and that the public knows that we will ensure that the damaged batteries are properly removed and disposed of safely. We'd like the people to know and the public to know that if anyone from the public has any questions, concerns, or information, please call us at 755-4505. And you could also fill out a online environmental health concern form at mtyhd.gov/EH. And that's capital EH for environmental health. And that's all. Thank you, everyone. I can't hear you, Maya. I think you're on mute.
I have a feeling I had an audio problem there. Sorry about that. Thanks very much. Let me repeat that question. A variety of people have a variety of concerns related to the fire. Many of them are concerned if they have fruit trees or home gardens, is their produce safe to eat, or should they take some steps to make sure that it's safe to eat?
Sure. Thank you for Oh, I'm getting echo. I'm sorry. Is there echo coming through? No. Yeah, thank you for that question. And we'd like to let the public know again, you know, it's the same advice and recommendations that we gave out during the wildfires and most recently after the floods. It's always good practice to wash your produce and practice good sanitation, wash your hands. Obviously, if there's fire residue, ash or debris, make sure that you take proper precautions to handle that. With regards to the safety of food, as long as you take, you should be good to go. Again, we are currently assessing whatever impacts there may be out in the environment. The Environmental Health Bureau, along with our state partners, are doing assessments and evaluations, gathering all the data, all of our observations, so that it would direct us to take proper next steps, which includes for the responsible party to take also proper next steps to ensure that if there's any impacts to the environment, that it's properly addressed.
Thanks very much, Rick, for that. And then for people who have questions, you're welcome to put your question in chat. And I do have one for you, Rick. Have all entities testing soil and water concurred with the findings of heavy metals in soil and water? And I think this reporter may be referring to the recent release by Moss Landing Marine Labs.
Right. That's another good question. As I've mentioned, our interpretations are still pending. It's very important for us when we make a statement of what we find out there, that we take in all the information, because at least for me as your local health inspector, as your local regulator, it's going to direct us to the next steps for proper cleanup. Have all the entities testing soil and water concurred with the findings of heavy metals in soil and water? I would say that at this time, we're very glad and appreciative that there's concurrent testing by concerned members of the public, because that would also inform us of where to look, and where we need to take steps if anything. So we're still waiting for our interpretations. Obviously, our focus is the area where the fire incident occurred, the areas close by, and the direction of the plume. So hopefully that answers your question.
Thanks, Rick. Are there any other questions for Rick based on what he has talked to us today about, or any other questions you might have? I am not seeing any. You're also, if you want to raise your hand, you could also do that if you didn't want to put it in chat. Not seeing any. Rick, thanks very much for joining us briefly today just to provide this update. The community is very interested in these results and really looking forward to the information that you can provide.
There's one more question from Christian Balderas. If I may, there's a question.
So actually, and thanks for there is a question, but Rick, don't leave yet. There is a question that came in. What is the status of and timeline for testing being done for soil testing?
Mm-hmm. Thank you for that question. We hope to have an interpretation so that we could report out by the end of this week. But I'd also like the public to know that we're not done. Whether we have findings or nothing to report by this Friday, we're not done. The Environmental Health Bureau, as your local regulatory agency, we're going to ensure that there's proper cleanup and that the responsible parties take action where they need to. So again, it's very important for us that we are very careful on reporting out what the results are, what the findings are, where we're finding it, how we found it, and where we need to look. So timeline, hopefully by the end of this week. But even with that, we're not done. Our goal here is proper cleanup and proper actions and follow-up by the responsible party.
Another question for you, Rick. Have you received, and by you I mean environmental health, received data from the Moss Landing Lab, San Jose State University study?
Sure. We're aware of the data. We have not received the raw data, from my understanding. And there's a peer review process that the Moss Landing Lab is going through. But again, the Environmental Health Bureau, the county, everybody involved at the regulatory level, we really do appreciate the public being aware and concerned of what may be out there. Maybe not just with the incident, but the environment in general. So information like this, whether they give us the raw data or not, helps us point into the direction of where we need to look, because we do appreciate the extra eyes and ears out there. So we do have the data, the information, our observations during the fire of where to look. And then when we do find the findings and make determinations, again, it's very important for us to be clear of what those findings are so that we can take the appropriate actions for proper cleanup.
And then another question for you, Rick. Is the county formally requesting that information, or is the county going to wait until after the peer review process that you talked about?
Sure, they can give us the data. Anybody can give us information, whether it's from a professional scientist, concerned citizens, grassroots efforts. Information from the community is very important to us because we're serving the community. Again, we're doing our process. We've requested additional resources to get official findings so that, again, as part of our process for cleanup and enforcement, that the responsible party takes the appropriate actions.
And another question for you. Are you looking to expand testing beyond the areas near the fire that may also have been potentially affected?
Yeah, very good question. You know, with heavy metals and the very tiny particulate matter that these heavy metals could be, that they would attach to, and then during the fire travel in the direction of the plume. That is kind of like where we would take into all these data points and factors to point us in the direction of where to look and how far to look. It does get more difficult the farther out you are from the incident, from the fire, to associate what you find out in the field could be associated to the fire, especially like with airborne issues, and in this case, heavy metals, because the heavy metals, I think in this case, we're talking about nickel, manganese, and copper. They're also present in a lot of other things out in the environment, like car emissions, vehicle emissions. There's some naturally occurring items. So the farther out you are, more difficult to associate. But again, that's where it's very important for the public to contact us with questions or concerns. Having an extra set of eyes and ears is always great. As a regulatory agency, we do get information. As an enforcement agency, getting information is good. Expanding out the testing area, as long as we do it smartly and with direction, and definitely in consultation with our state partners. We're also working with state partners, not just for the environment, but also public health. That would also drive the direction of where to go. This incident, it's very similar to many things that we do in environmental health. We're also in the business of inspecting restaurants. We inspect your public swimming pools. People who have concerns about getting sick from swimming in a public swimming pool, to making sure that there's proper chlorine in there. We do this for gas stations to make sure that there's no leakage from the tanks. We inspect the water systems to make sure that there's no exceedances and things that shouldn't be there. So this is nothing new for us. So whether we expand out would depend on our findings, and it definitely is driven by an objective that if there's enforcement actions to take, there's proper steps to take.
Thank you very much, Rick, and thanks for that analogy that shows a lot of how this is something that you're prepared to handle.
Mhm.
Are there any other questions for Rick before we move on to our next topic? I am seeing none. If any do come in, we will forward them to Rick to try to get a response to you. What? Somebody got typed fast just in time. Rick, when will you talked about the batteries at the plant. When will those batteries be removed? Is there any timeline or estimated timeline for that?
They're a very good question. Obviously, we'd like to have those damaged batteries removed as soon as possible. But again, we want to make sure that it's done safely and properly. There's plans that need to be reviewed and submitted and then reviewed and then approved. Usually, cleanups take anywhere from 30 days to a year, depending on the complexity and the scale. This obviously is of the higher scale. So much more care and deliberation and diligence needs to be done. So I want this done quickly, but properly and safely. So ETN timeline will be transparent on ensuring the public is aware of it within the boundaries of what I could say in the scope of it, this also being an enforcement issue. Right now, what I also like to say, Vistra has been very cooperative. I like to emphasize that. It's very important to know that the public knows that Vistra is being cooperative with us. So I have no doubts that we will get this done. We, meaning the county, the responsible party, takes the appropriate action to get this done in a timely manner. I would not like this to go beyond a year, But again, I want this done properly and safely.
And then, Rick, we have one more question. Now that we're hearing about soil samples, both of the county sampling and San Jose State University, but what about testing water in areas such as Elkhorn Slough? And we do know that water samples were taken as part of the initial round of sampling.
Yes, water samples have been taken. The Environmental Health Bureau, like your local health inspectors again, were responsible for what they call water systems. Water systems are your drinking water systems, not just like the water. No, we're not talking about the ocean or the rivers. But the water systems we do regulate and test because primarily the concern for public health. So water has been tested in addition to the soil. Now, if you're talking about ocean water and riverways, I do believe that's part of the scope, but our primary mission, at least for environmental health, is the health of people. What they could drink, what they could eat, and what they're breathing. The natural resources side, I believe that there is a subgroup of our total team that is also looking at that, and we're definitely partnering with them to seeing whatever we could do in terms of proper cleanup enforcement and actions that need to be taken by the responsible party.
I'm going to give just another second in case there's anybody typing a question before we move on, because I've moved too quickly and I want to make sure everybody has a chance. Seeing none, again, Rick, thank you very much for responding. And again, for the community, as we get the information, we have been very transparent at the county about publicizing data and what we have, and we will continue to do so. Thank you, Rick, again. And we're going to go ahead and move on to our next topic. We're going to talk about the CARE Act. Now, the CARE Act, which some of you may know about, created a new treatment and services options for adults who are not currently stabilized in their treatment. But there are many questions about how the program works, who's eligible, and how can someone get a referral. There's a special webinar next week, early next week, that will provide a lot of that information. And we're very pleased to have Melanie Rhodes, Behavioral Health Director with the county, to talk about the program and about the webinar. Hi, Melanie.
Hi, thank you. Appreciate the opportunity to join today and to just let the community know that Behavioral Health will be hosting a presentation and Q&A session by Zoom on Monday, February 3rd from 5 to 7 in the evening. So open to community partners, interested stakeholders, anyone in the public who wants to learn more about the implementation here locally of the Community Assistance, Recovery, and Empowerment Act, also known as the CARE Act, which went live here in Monterey County December 1st, 2024. And as you said, it creates a new pathway to deliver mental health treatment and support services to eligible individuals. And again, this is for adults 18 and over who have untreated schizophrenia spectrum or other psychotic disorders and are not currently stabilized in voluntary treatment. The presentation will be provided by myself and one of our deputy county council staff, Christy McDonald, and we will be providing an overview of the CARE Act, what it is, and the overview of the court process. We'll be reviewing in detail the eligibility criteria and further explain really who CARE is designed to serve. We'll also explain how someone gets referred to CARE, who can file a petition, what that petition process entails. And we'll also be providing some general information on resources for individuals and families. Not everybody is going to fall into the population that CARE is designed to serve. And so there's also questions about what other resources are available and how can folks access services. So again, the event will be held by Zoom Monday, February 3rd from 5 to 7, and Spanish language translation will be available. And I believe the flyers in English and Spanish have been dropped into the chat, as well as our link to our website where there's more information about the CARE Act.
Melanie, thank you very much for walking us through this. Have you found that there is a lot of, I don't say misunderstanding, but a lot of lack of knowledge about how the program actually works? I think there's a great interest in the services, but people just must not be sure, like, how do you get there? And of course, that sounds like what the impetus for the webinar was really all about.
Exactly. It's our effort to get accurate, correct information out to the community. We have been for, the whole entire calendar year 2024, working very closely with our court and, other partners, our justice partners, our community, interested stakeholders, our hospitals, and service providers to get information out about the CARE Act, what it is, how to refer, how to connect with us with questions. So we have been targeting different groups throughout last year, and then also working very closely with our court and partners to figure out sort of that workflow and that process, and to have a smooth launch here for us. So all of that planning that went into it. So now we're ready, and so we want to just get the information out to the community, answer their questions, and try and, our goal with behavioral health is really to be able to provide timely access to the needed services for our Medi-Cal beneficiaries, our safety net population, and folks who are, eligible for a variety of different programs such as the CARE Act. And so trying to get that information out so we can help folks get, connected as quickly as possible is really important.
Really great to hear about the webinar. I'm really glad. It's just one more avenue to get to people with information that they need. Thank you, Melanie, so much for coming on and just to remind everybody what's coming up and really how to access the webinar and information about the program if they need it.
Great. Thanks for having me.
Thanks, everyone, for joining us on the news briefing this week. Our next briefing is next week, and we'll see you then.